Okay, so I think this is where we left off with severe sepsis. Let's continue our discussion of sepsis. Severe sepsis will always require two codes at minimum. And the code will be for the underlying infection, such as category A40 or A41, or codes from OB, arterial or post-procedural sepsis. So you're always going to have either this A40, or in the case of obstetrics, a code that begins with OB, or some other sort of post-procedural sepsis is the first code. The next one will be an R65 code. This will always be a second code. This is for severe sepsis. And then the character that you see over here, this is just a placeholder in this case, that will indicate whether septic shock is present. And then you would use additional codes to talk about what type of specific organ failure, such as the acute respiratory failure, kidney failure, what have you. Now, and look for codes R65.20 and R65.21. As we talked about earlier, the one you would only use for severe sepsis. And again, these codes are never used for first listed codes. There is a note saying to code first underlying infection that will direct the coder to code that particular infection first. When severe sepsis is present on admission and it's the principal diagnosis, the underlying systematic infection will be assigned as the principal diagnosis, followed by the appropriate code from the subcategory of R65.2. What does this mean and why you should care? When severe sepsis is on the admission, and this goes back to our definition of what a principal diagnosis is. A principal diagnosis is the reason the patient is admitted, keywords coming, after study, right? So in the case of somebody with severe sepsis, yes, they are being admitted for severe sepsis, but they're being admitted because of an infection, right? And we know the infection because it's, quote, after study. So some people get tripped up by that. If a patient's admitted to the hospital for sepsis and severe sepsis develops while they're in the hospital, again, the underlying systematic infection that caused the sepsis and the appropriate code for this subcategory R65.2 is assigned as a secondary diagnosis. On the present admission indicator, which we'll talk more about, this would be as no. If a patient's admitted to the hospital with an infection in a body system, such as pneumonia, and then it goes to sepsis or severe sepsis, the code for the systematic infection is, and this would be one of the A40 or A41s. Another code would be assigned for the localized infection as the pneumonia, and then following the R65.2. If a patient's admitted to the hospital for treatment of pneumonia or another localized infection, and this localized infection worsens to become systematic and then sepsis or severe sepsis, the local infection would be reported first or coded first, right? And additional codes are assigned for sepsis or severe sepsis. So sometimes we have sepsis due to a post-procedural infection, post-procedural septic shock. And you can see some of the steps you take outlined in your tabular. Now let's talk a little bit about HIV. HIV is the virus, of course, that causes acquired immune deficiency syndrome, which we know as AIDS. When we talk about HIV, we're talking about HIV-1. And what this virus does is destroy certain blood cells used in the immune process, the CD4 and the T cells. And as these T cells get attacked, the patient becomes more susceptible to infections. And then typically anybody with fewer than 200 T cells or a percentage of less than 14% is considered to have AIDS. AIDS is the late stage, if you will, the late manifestation of HIV. AIDS is the code B20. And another way we can say AIDS is AIDS ARC or AIDS-related complex or symptomatic HIV infection. This code of B20, which is used for AIDS, is mutually exclusive with the other two codes you see on the slide, namely the asymptomatic HIV infection. And when we say asymptomatic, of course, we're saying without symptoms. So you can have active AIDS with symptoms and asymptomatic, right? Likewise, if they have AIDS, somewhere there had to be some sort of test, so we can't have an inconclusive lab test of HIV. We only code AIDS when it's confirmed. Things like suspected, possible, or any type of adjective that reflects some sort of uncertainty are not coded. We only code confirmed cases of AIDS. If used, we should ask the physician, query the physician, if you will, to clarify what's known for certain about the patient, whether they have test results or what have you. And with an HIV-related illness, it requires two codes. First, we have the B20 for the AIDS, and then additional codes. So if you look in your tabular, you will see those notes that are very important, and another reason why you'll always check the tabular to check things under B20. AIDS and HIV-related illness in pregnancy is a little bit different. As we'll see generally, anything related to OB is kind of a separate category, and we'll talk more about this later in the course. In the case of pregnancy, childbirth, or postpartum HIV-related illness, the code would be 098.7. And this is covered in guideline 1.C.1.A.2.G. If a patient with HIV is admitted for something totally unrelated, such as a traumatic motor vehicle accident injury or a disease that's not caused by AIDS, you're going to code first the unrelated condition. And then, of course, you would code, meaning report, the HIV, the B20. And again, if we're asymptomatic, they have no symptoms, right? They may be HIV positive, but there is a percentage of patients who are positive but don't have any manifestations, any symptoms. This is where we would use Z20. And again, important note, it is mutually exclusive with the B20. Any patient with any known prior diagnosis of this should be coded with the B20. Once the patient has conditions related to the HIV and it resolves, the B20 is used. In other words, if they were asymptomatic and then they become AIDS and have symptoms, you use the B20. You no longer use that Z21. And then after a patient develops an HIV-related illness, the patient always is going to have that B20. And again, goes back to the coding guidelines. We code all conditions that affect the management of the patient. If somebody is going for an AIDS test, this is an encounter that we talked about in chapter 24. This is a Z code, in this case, Z11.4. And these encounters are often in patients without any signs or symptoms. If they have high risk behavior, we would use additional codes such as the Z20.5 for high risk sexual behaviors. We would also code the Z71.7 for HIV counseling. That's all I have for you. Come back for more as we finish up our infectious disease coding.